We are continuing our discussion on the coronavirus or COVID-19 pandemic. And with new case numbers on the rise throughout parts of the country and increasing slightly here in Florida, many residents are questioning what we should do next. Face masks are still required throughout many Central Florida communities, and more vaccine and testing sites are opening to accommodate the numbers. So, what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our state medical professionals, and joining us is Alvina, epidemiologist with the Florida Department of Health in Orange County. Alvina, thank you for joining us today. Always good to see you.
Thank you for having me again.
You know, a lot of people have started to get vaccinated. So the question is, once you get vaccinated, can you stop wearing a mask?
So not quite yet. The vaccines are really great at preventing severe illness and death. But we're still trying to get some information about the transmission. So we're optimistic, though, that even if there might be some small amount of transmission, that the vaccines are really great at reducing the spread.
And speaking of vaccines, where are we now as far as eligibility is concerned in Florida?
We're really excited to announce that starting Monday, that everyone who can get that vaccine who's been approved, so those who are 16 and up for Pfizer and then 18 and up for the Johnson & Johnson and Moderna, are eligible to get the vaccine at any Florida site.
And since we will be opening up more eligibility, where can we get vaccinated, and what's the process for signing up?
Well, at the Orange County Convention Center, we have our appointment portal, which is patientportalfl.com. And so you would go there to register for an account and then make an appointment when the appointment slots become available. We did open the appointments this morning, and unfortunately, fortunately, they are all filled. And we will open up more appointments as more vaccine comes into Florida, into Central Florida. But also there are other places where you could still get vaccinated, such as the federally run FEMA sites, and also the federal program run with our pharmacies, our partner pharmacies in the community.
And you know, a lot of people still have hesitation about getting vaccinated because there are a few cases of people who actually got COVID after getting the vaccine. Is that something that we should be worried about?
So after getting the first dose of vaccine, you're not completely fully immunized. And after you get your second dose of vaccine, you're not considered to be fully immunized until 2 weeks after receipt of that. Or if you're getting the Johnson & Johnson or a single dose vaccine, it would be 2 weeks after that dose. And so your body needs a little bit of time for the immunity to build up and to protect you. So unfortunately, this is partly why we recommend that you continue your pandemic precautions until you become fully immunized, because in that period, you are still susceptible to possibly becoming infected. And also, not every vaccine is 100%. So there are actually no vaccines that are 100%. And so we should still continue these precautions until we can get a good handle on the pandemic.
And we are in the midst of spring break here in Florida. Are we seeing the numbers of younger people go up?
We have. So over the last couple of days, we have seen some increase in the number of cases, and also in the proportion of cases that are circulating in the younger age groups, specifically the 15 to 34 age groups.
And you know, have heard that Florida has the highest amount of the UK variant spreading in the US. Will the vaccines help us against these variants?
So right now, the vaccines have been shown to be effective in protecting us, at least from severe hospitalizations and deaths, even against the variants. One push for why we want everyone to get vaccinated as soon as possible and to continue these pandemic precautions is we often don't know if you have been infected with a variant until a long period of time afterwards. And just part of that is conducting the genomic sequencing to identify the variants themselves. And so you may be infected with a variant and not know it, and thus potentially help contribute to the spread if you don't continue your pandemic precautions.
So the bottom line is stay vigilant. Absolutely.
Exactly. Don't let up yet. We have made, I guess just don't waste the progress that we've made with all of the vaccinations. And up until this point, I know we're reaching some pandemic fatigue. We've passed the year mark. And one thing to note is, interestingly, we are at the same level now as we were last year in July, when we had instituted all the lockdown measures and the remote distance and the remote learning and the remote workspaces. And so I know we're all pretty tired of it, but we're really hopefully seeing the end, or at least seeing some better path. And so now's not the time to let up. So we want to continue to practice our pandemic precautions until we get a good handle on this and to reduce the spread of the variants, as you had mentioned.
Well, Alvina Chu, thank you so much for being with us and always keeping us informed from the front lines of this pandemic. We appreciate your time.
Thank you.
And we'll be right back with more. Stay with us. We had a chance to catch up with Orange County Mayor Jerry Demings at an event earlier this week for an update, and here's what he had to say.
Here we are, the last day of March, and we have 121 plus thousand persons who have tested positive for the coronavirus within our community. 1,182 individuals have died as a result of the virus. On average, we see 330 plus new cases each day. However, we have started the process now of vaccinating people within our community. We have provided approximately 500,000 doses within Orange County. We have inoculated about 40% of our population that is 18 years old or older. We have inoculated about 40% of our population that is 40 years of age or older. We have inoculated about 28% of our population that is 18 years of age or older. So we still have a lot of work to do to get our community fully vaccinated. In order to get to that point, the pinnacle is 79 to 80% of our population will need to have been vaccinated. So we're well on our way. The vaccine inventory has increased significantly, and we have a number of community engagement projects to ensure that those who want to be vaccinated can do so without cost to the individual. So our program here in Orange County has resulted in a slowdown overall in terms of new cases, but post spring break period of time, our numbers have begun to increase slightly. Our 14-day positivity rate is approximately 5.9%, whereas it had been 5% just a week ago. So the numbers are ticking up slightly. So that really means that our community has to continue being vigilant with masking up, socially distancing, and making certain that they take care of all of those other sanitary protocols that have been recommended.
Thank you, Mr. Mayor, for keeping us informed about the pandemic here in Orange County, and we will be back with more. Stay with us. As vaccination numbers increase across the country, some people are still questioning how effective the vaccines are, or for that matter, how they were made. Dr. Vincent Hsu, AdventHealth's infection control officer, is here to discuss. Dr. Hsu, thank you for being with us today.
Good to be here, Clarence.
So a lot of people are hearing about side effects because of the vaccine, and even a handful of people have died after having the vaccine. So the question is, people want to know, is it safe to take the vaccine?
It is safe to take the vaccine. We do hear about side effects, and most of the side effects that we hear about are generally very mild. They would be soreness where you get the vaccine. And for some people, they could have headaches, they could have fevers, feeling under the weather, flu-like symptoms, and those account for the majority of what's going on. The very serious adverse events are such as anaphylaxis or severe allergic reactions. Those are very rare. Whenever there's vaccinations, there is always that very small risk of serious side effects. So we know that they do occur, but when you weigh that against the impact that COVID has had, and many of you may have had friends and relatives who had COVID, and obviously 550,000 deaths in the U.S., I think most of us should understand that it is a very safe vaccine. The benefits of getting the vaccine just far outweigh the potential costs of getting COVID.
And vaccines usually take years to, sometimes even a decade to develop. But this one was done pretty quickly, which is another thing that's made some people uncomfortable. How was this developed so quickly?
Well, we have better technologies now, and we have the public, the funding and the will to get this done. This is a pandemic. This is a public health emergency. And so we had improved cooperation throughout the world and with all major manufacturers working together. But what I want to say is this: even though the ability, even though we took time to get the vaccine, and it was done, in a very quick manner, it was not because we compromised safety. There were no shortcuts taken in the development of this. This was subject to trials in phases that involved thousands of volunteers. And so I think everyone needs to understand that even though it was an accelerated timeline, there were some risks in so far that they made millions of doses before they were approved in the hope that they would be approved. But the safety and the trials were conducted in the usual way, and so there were no shortcuts taken. This was a very well-designed trial.
And coronavirus variants are spreading, especially here in Florida. Will the available vaccines be able to protect us from these variants? And will we at some point need a booster shot in order to move forward and be safe?
That's a great question. I wish I had a crystal clear ball to say, we may or may not necessarily require a booster. I do think that we are probably going to need a booster at some point. I don't know how often it will be. With respect to the variants that are out there, the main variant that is here in the U.S. and in Florida is what we call the UK strain, the B.1.1.7. And that, unfortunately, is going to increase in prevalence. But the good news, and the very good news, is that the ability of the vaccine to neutralize and the ability for it to take care of the B.1.1.7 vaccine is very, very good. So there is very little resistance to that strain. We will keep our eyes peeled open for other strains that are in the U.S. There's a Brazilian strain, the P1, and South African, which is called the B.1.351. But right now, so far, the important message is continue to do what we can to social distance, to wear a mask, and to get vaccinated, because that will slow the spread of the variants.
And Dr. Hsu, if you get vaccinated, but some of the people around you do not, is it safe to be around those people? Is there such thing as herd immunity?
Yeah, you hear the word herd immunity a lot, and what we are trying to achieve with herd immunity is to get enough people vaccinated and protected so that it doesn't spread to other pockets of unvaccinated people. Um, and everything makes everyone that gets vaccinated makes a difference because what happens affects other people. And so the general approach is that if you are vaccinated and you are exposed to someone who may have the coronavirus, it does protect you, the individual, against getting disease, and especially severe disease, which is really what we want to do. It is theoretically possible that perhaps there can be a little bit of replication that goes inside the person that was vaccinated, and potential spread could occur. But we believe that way of spreading is much lower when you're vaccinated. So there are really two advantages for vaccination. One is to protect yourself. The other one is that when you get vaccinated, we believe that there's a very high probability that your ability to spread to others is also much lower, and so you're protecting others as well. And that's our goal, is to get as many people protected as possible.
Once we are vaccinated, how will our lives be different, and what will we be able to do?
Yeah, I mean, what we want to be able to do is to get back to our normal lives, isn't it? We want to be able to get together with our friends, with our family, see our grandparents, see the grandchildren. We want to be able to travel and meet together in groups that are large, and what we're able to do right now. And we're starting to see signs that that is occurring. We are, the CDC has looked at the data, and they now say if you're vaccinated and you have small groups vaccinated, you can now get together with these small groups, and you don't even have to wear your mask, and you don't have to be 6 feet apart. So it's slowly getting back to normal. And in fact, just today, the CDC had issued guidelines now stating that if you're vaccinated, you can travel. You need to wear a mask still in public, but traveling poses it's a very low risk for you. So we want to get back to normal, and I think this is a really important point, that when you get vaccinated, you are helping not just yourself but all of society to get back into a more normal routine, and that's what we would like to see. But it's going to take slow steps to get there.
Well, Dr. Hsu, thank you so much for keeping us informed from the front lines of this pandemic, and we appreciate your time today.
Thank you very much.
Stay with us. We'll be right back with more. We've had our next guest on our program a few times throughout the course of the pandemic to discuss one of the community's greatest needs: where to find food. Karen Broussard, Vice President, Agency Relations and Programs for Second Harvest Food Bank of Central Florida, is here to talk about the newest ways that they are helping with food insecurity. Karen, thank you so much for joining us again. It's always good to see you.
Well, same here, Clarence. Thank you so much for the invitation. I appreciate that.
So, Karen, can you give us an update on where we are as far as food insecurity here in Central Florida?
Sure. Well, now that we are, as we all know, probably 12 months in, we've hit some onerous anniversaries here. We've learned a lot, and we consistently hold at about a 50% increase in distribution. So where prior to March of 2020, we would distribute about 150,000 meals out of our warehouse in Orlando, beginning by, I would say, the first week in April of 2020, we were distributing about 300,000 meals a day. That is still holding. There's a very, very slight decrease, but really not anything that we can call a trend yet. We also know that about 40% of the people who are getting food from the food bank are new to having to look for supplemental or emergency food. Those are the folks who were working, at the theme parks or in the hospitality industry, in that sector, anywhere from, folks who were working for, hourly wage, to folks in management. Those are the folks who were furloughed and then ultimately laid off. People working in restaurants, hairdressers, et cetera, who were out of work for quite a while. So we know that that's about 40% of the people that we're serving now. Another thing that we recognize is that more and more people than we ever recognized really could not get to food at all, either because they had COVID, were in quarantine, were at high risk, had not gotten their vaccine yet, which of course is a relatively new phenomenon in the whole 12-month scenario, the story of our history for the last 12 months. And so we were working to recognize and identify who those folks were and try and get food to them in some new ways. So those are the big things that we know. We understand that jobs are coming back. And even though they seem to be coming back, we're just so thrilled to see any jobs coming back that it still is going to have a very long tail, because for some folks who were living a paycheck away from disaster prior to the pandemic, they are in no better shape now. They have hit that last paycheck, obviously, and they are in great need. They're going to be in need of support probably for a while. It's going to have a long tail for recovery here.
Wow.
We fully expect that.
That's something. And also, tell us about the new expansion happening at Second Harvest.
Yeah. This is something we're really excited about and very grateful, honestly, to the CARES Act and Orange County's CARES Act as well, that they received from the federal government in the last year. We're just very grateful for it. What it has allowed us to do is stand up a brand new state-of-the-art 20,000 square foot food production facility. We had been doing food production at the regular food bank warehouse for really the last 7 years. And that was mostly meals, hot meals, for the summer food program when kids were out of school, for Head Start programs, after school programs like the Boys and Girls Club, things like that. With the pandemic, many more people needed prepared meals at home. And while kids were not in school, the state and the federal government really relaxed a lot of rules that allowed us to start feeding kids and their families through programs that we normally could not do. And it allowed us to provide 7 days worth of meals at once and deliver it to children and their families. That then increased our daily volume, or the need for producing more meals, really exponentially. So we went from producing in the neighborhood of 5,000 to 8,000 meals a day regularly pre-pandemic to almost 25,000 meals a day. So we really truly outgrew our existing facility. We see that the need is going to continue even as kids transition back to school, to be able to produce many more meals. And we're also going to move into some different types of programs around meal production, actually finished meals instead of the raw product that we also distribute out to our network of pantries. So the new facility is going to allow us to do that and then grow that number if we need to over time. So we were able to stand that up. Yesterday, I was hearing the numbers, 80 days it took us from start to finish, including, installing a generator and permits and all of the things that you need to do. And it's really a remarkable facility. And within days of moving in, we were up and running that many meals a day, 24,000. So wow. Very proud of it, and incredibly grateful to Orange County for being able to have the confidence in us to do that kind of work. So we're thrilled about that.
It's really excellent. And in light of COVID-19 and the safety precautions that are pretty universal now, how are you distributing food and keeping your staff and volunteers safe?
Yeah, it's a great question, Clarence. We're all much better at it now than we were in the beginning, aren't we? We were all quite terrified and really just trying to figure it out. But we feel like we've done pretty well with it. We had a couple of really significant challenges to start with. One was obviously that we didn't really know, we didn't know that much about the virus. So it was important to not be near everybody and create social distancing. Well, how do you do that when your job is to distribute food into the hands of people who are hungry? So we shifted to a mobile model, and we went from doing about 20 a month, 20 mobile distributions where people drive up in a line and open their trunk and then food is put into their trunk. We were doing about 20 a month, and it would attract about 100, 150 families or households. As soon as we got started on this, we ramped up to doing about 60 a month. And this is when you would see the pictures of the really long lines. You would also see them on the national news, et cetera. But ours, locally in Central Florida, we didn't really opt to have, thousands of people online. But what we did have were about 60 of those events a month that attracted in the neighborhood of 400 to 800 households each. So a significant ramp up in distribution, but it was safe. Of course, every volunteer that was there, everybody involved, we all adhere to social distancing. Everybody was masked, plenty of hand sanitizer to go around. It just sort of became ubiquitous. It was everywhere. So that's how we did that. In terms of our staff at the food bank itself, our warehouse staff had to be there every day. So that was a challenge, but again, same protocols. We instituted lots of protocols within the building, lots of stanchions, distance. We have some technology so that people take their temp as they walk in. Lots of hand sanitizer around, a lot of protocols in place. And we've managed pretty well to keep everybody, for the most part, healthy. We had a few people get sick, but thank goodness they all got well again as well. The other thing was that we work on the model of this huge network of community partners who are the feeding programs that are part of our network. Many of them work primarily with volunteer help. They don't really have a lot of staff. So that volunteer help usually were older people who really were more susceptible to the virus. And so we lost a lot of volunteers among our network, and even volunteers to come into the food bank to do the packing and repacking and sorting that is so critical to the work that we do. So we reduced the total number of volunteers that could be in the food bank at any given time. We spaced everything out significantly. And again, we took it extremely seriously. If you did not work in the warehouse at Second Harvest like myself, you can see that I am not in my office, at least not in my office at the food bank. We have been working from home almost all of this time, and still we got it done, and we continue to get it done. So we're all anxious to be able to get back to work together, though. We're certainly looking for that interaction again as soon as we can get it. So that's how it worked for us. We continued to figure things out on a daily basis. We created some programs that were really critical for the community in addition to the Mercy Kitchen. And we'll continue to do everything we can to navigate through all the surprises that we get at the food bank.
Well, we are so thankful for all of the work that Second Harvest does in our community to keep those in need fed, and always appreciate your time being with us.
It's my pleasure.
Have a great day, Karen. Thank you.
Thank you, Clarence. Bye.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. And we are also here to help you keep making those healthy connections. Stay safe.